Welcome back to the broadcast. Well, if you are one of the many people who seem to gain weight right around your midsection and you don't know why because you think you're doing everything right, well, you might actually be insulin resistant. It is also a key factor in detecting diabetes, and Dr. Tara Dahl from Health Diagnostic Laboratory, Inc. is joining us now to talk more about that. Welcome.
Thank you for having me.
Good to have you here. And
Great
of course, we have Amy in the segment too, because you drew all of our blood and did a screening on all of us. And this particular segment, Amy needs to listen to, along with many others at home.
Well, you said weight around your gut and your butt and your thighs.
It's actually more around the gut that matters. Everywhere else is, just about the beautiful hourglass.
But it's an interesting topic because Amy has been, real diligent lately about, the way she eats. She's really kind of cut out the carbs, and she's exercising more. And you said for someone who is insulin resistant, whose numbers are not where they need to be, that's key.
That's exactly what you need to do, because your body's developed a resistance to insulin, and the way to treat that is to eat low sugar, low carbohydrate diet. And if you're going to eat carbohydrates, sort of the better carbohydrates, you want to make sure that you're getting fiber in just about every meal, fiber or protein, because that really helps slow the rise in blood sugar that'll happen as a result of eating the food. So it's really key.
I started the paleo on the 1st, and today's around, we're 20-something into this.
Right.
I have lost weight, and it wasn't so much really to lose weight as it was just to feel better.
To feel better, right. And I think it's a good point to point out that people who are thin can have this, because we have in our minds, like we can pick out people in the room and say, oh, if you've got abdominal weight, that you must have this, and then that the thin people don't have it. And that's not true, because you can gain weight, even if you're thin, you can still gain weight in the abdomen. It's called visceral fat, and that's very metabolically active fat, and it can cause all sorts of problems for us and really put us at risk for diabetes and heart disease.
What is being insulin resistant?
Let me explain this. Let me try to simplify this. So I'm going to talk about what happens in the normal setting. Okay, so we eat, and our blood sugar goes up, right? So up it goes. Our body, our pancreas, secretes insulin. And the point of insulin is to make our blood sugar come down to normal. So we'll have a breakfast with some carbs and sugar in it, and it goes up, and then the body secretes insulin, it comes down to normal. And that's what's supposed to happen. But when you have insulin resistance, and you may have that because you're genetically predisposed to it, because maybe there's family history of diabetes, or maybe it has to do with your lifestyle choices. But either way, what happens is your body develops resistance to that insulin. So when you eat, your blood sugar goes up, your body secretes insulin, but it's resistant, so it doesn't work.
It doesn't
bring your blood
sugar
blood sugar comes down, but not to normal. So that's like, hey, pancreas, give me more insulin. So your pancreas works on overdrive to try to give you more insulin to make your blood sugar normal. And your blood sugar stays normal. When your doctors check your blood sugar, it looks normal. And so nobody has any idea that you're resistant to insulin.
Until you're testing for resistance.
Yes, so what we do then is we measure insulin levels and free fatty acids and some other markers that will tell us this is happening, and it's this sort of hidden thing happening. If we don't do anything, high levels of insulin cause weight gain, and they cause weight gain in our abdomen. They also can cause the particles and the cholesterol numbers to be abnormal and blood pressure to be abnormal. And if we do nothing, if we just let this go, and sort of just, you live your life, you do what you do, the pancreas eventually is like, I can't do this anymore. I'm just kaput. And it stops working. Well, the pancreas will start to lose its ability to make insulin, and then the insulin levels start to drop. But then what happens to your blood sugar?
Keeps
all of a sudden, boom. Now you show up in the doctor's office one day and somebody tells you, you know what, you have diabetes. That does not happen overnight. That happens over 15 years. And what we do in our society today is we diagnose diabetes by waiting for a glucose to be abnormal. But actually, we need to find out who's insulin resistant, because if we can discover that, we can prevent diabetes.
Then your glucose
and make
never
you
gets
feel better.
abnormal.
Right. And it's so fixable. I mean, you do the right kind of diet. Paleo is an excellent way to address this.
Do you think this is why older people tend to get weight gain in the belly? I mean, I know my Meemaw, she's a little bitty thing, but at the end, she just had that little round belly.
Yep, absolutely. Insulin resistance worsens as we get older.
The biscuits that she made, which were divine.
No, but I think that if there's anything to be learned from this segment, I think it is that if you have the right information, and the right information means getting the proper tests, which you can do at Health Diagnostic Laboratories. You get the proper test, you know what you're dealing with, and it's avoidable.
Absolutely.
I mean, you can keep these things at bay so that you never have to wake up one morning and go, oh, wow, I have diabetes. Because, I mean, we could talk a whole segment about how awful that is and what that leads to.
So I need to continue eating, you said, protein with every meal.
Protein or fiber with every meal. And try to stay away from sugar. I mean, simple sugar is
Right.
obvious to stay away from, but carbohydrates, I mean, breads and pasta can be really high
Snicker bars,
in
no.
simple sugar. Probably not. Well, the Snicker bar has a little peanut in there. I mean, maybe that's some hope
I'm
for
just giving you a
Snicker
hard
bar.
time. I know exactly what to do. So,
Yeah, so
I just wanna
that's perfect.
So after this 30-day thing I'm doing, which is like a cleanse, I should just continue on,
Right.
And just continue to
Right.
feel better and the belly shrink and.
Right.
Okay.
Sometimes when we find on the lab testing that people have a little bit more advanced stage of insulin resistance, we do have very inexpensive medications that are really safe to take that, you know, you can use in pregnant women. They're that safe. That can be used if it's more advanced. But
Okay.
that's, you know, and you lose weight on the medication, everybody feels
And
good
I'm not
anyway.
a candidate for that.
I don't think you need it. I think you can do it with what you've already done with
All
your
right.
diet.
And real quickly, should we have these tests once a year?
I would recommend once a year. I mean, when I treat patients, I usually follow them, their treatment, and maybe do it a couple times a year, but certainly at minimum once a year, because you want to pick up on disease early.
Yeah, it is such good information.
Thank
You
you.
can talk to your doctor if you're interested in getting the HDL test. The HDL team is here with us every Tuesday, by the way, to talk about your health. So if you go and get a test, then you can just watch our segments and learn a lot more about your results. Of course, they have great consultants there, too, that can go through everything with you. You can get more information about Health Diagnostic Laboratory by going to their website there on your screen. The phone number is also there, or you can find more information about them on our website, thebroadcasttv.com. We are back in a moment with more.